So, good afternoon, everyone.
Good afternoon.
Hello.
Let's start. Let's continue the GI tract with the intestines. So previously we covered the duodenum and the stomach and the cardia and pylorus. So let's continue with the terminal part of the small intestine. So let's see the intestine, the ileum. So, you know, it's a typical luminal organ, therefore it represents mucosa, submucosa, muscularis layer, and adventitia or serosa, depending on the presence of mesothelial covering. So, ileum is the terminal part of the small intestine. And when we just try to compare the ileum and the other part of the intestines, we can find the typical, please mute yourself, okay, because I can hear some noise. So comparing with the duodenum, which represents Brunner's glands in the submucosa, in the ileum we can find a specific lymphoid aggregations called Pancreas patches. So looking at this view here, we can find the so wait. Yeah. Okay, no, that's better. So here we have the Pancreas patches. These lilac darkly stained structures, they are lymphoid aggregations at the antimesenterial side of the intestine. You know, that side where the vessels enter to the intestinal lumen called mesenterial side, and the opposite side called antimesenterial side. So the antimesenterial side are a typical site for the presence of Pancreas patches. Eventually, this is the exact site for the surgical treatments as well, because the vessels just surround the intestinal lumen and terminate approximately here at the antimesenterial side. So here we can cause the less damage of the vascular system when we cut the intestinal wall of the GI tract. So that's the reason why we call antimesenterial side. Okay. So Pancreas patches are related to the lamina propria, but mainly we can find them in the submucosa. Okay, let's see the innermost layer. So here, that's a nice area. Maybe here, that's better. So definitely as a part of the small intestine, we can find Kerckring folds, intestinal villi, and microvilli as surface increasing structures. So I just want to make sure you know this. So these are the plicae circularis or circling folds. Onto the surface of the folds, we can find these finger-like processes or these. So these are the intestinal villi, and the villi formed by the eventually the core formed by the lamina propria, while the circling folds formed by the submucosa. So innermost layer, the first layer of the tunica mucosa, is the epithelium mucosae. Here the epithelium is formed by simple columnar cells called enterocytes. So these are the enterocytes, the darkly stained, and among them we can find unicellular glands, goblet cells. And onto the apical surface of the enterocytes, there are microvilli increasing the surface. So that's the epithelium. Let's see the lamina propria. Lamina propria, which is in the core of the villi, that's cellular rich loose connective tissue. Cellular rich loose connective tissue, mainly lymphoid elements are presented here. And in the core of the villi, we can find vessels, arteries, veins, and obviously small arteries and veins, and also a lymph vessel called lacteal. So lacteal, that's a lymph vessel starting from the top of the villus and going down, uniting with the bigger lymphoid structures. So in the intestinal villi, we can find small arteries, veins, and lymphoid vessels called lacteal. To find the lacteal is a really difficult job because of the really soft wall of them. It's much more easy to find vessels. So for example, when we can see red blood cells here and here, that's difficult. That's definitely a place for the vessel, the vein and artery. Or we can see these smooth muscle cells forming just the wall of the vessels. So they are definitely belonging to the vascular system. And trying to show another one. Nice. This, look at that. Here we can also find red blood cells belonging to the vessels. Please mute yourself. So that belongs to the vascular system, and just a lacteal. Is a longer one. So definitely we can follow a vessel here. Many of the red blood cells are presented, but maybe we can see these smooth muscles here. It maybe follows a vessel or gathers a vessel inside. We can see red blood cells. And you know, endothelial cells line also the lymphoid vessels. So we cannot see, when we cannot see red blood cells in a lumen, but maybe it's just shrunken, so it's not the lumen, but it's quite similar to a lacteal. So it's really difficult to find the lacteal. So it's not a problem, and no one will ask you during the oral exam. So when we can see the smooth muscle cells, that's definitely a vessel, a small artery, vein, or lymphoid vessel called lacteal. Okay, I don't want to waste the time to find the lacteal because it's not really important. So let's back to the next layer. So in the lamina propria, which is cellular rich loose connective tissue, we can find glands. They are the intestinal glands. You remember, these are the crypts of Lieberkühn. So the crypts of Lieberkühn, these circular structures, which eventually secrete their juice just among the villi at the bottom of the lumen, of the intestinal lumen, and the cells which build up the crypts are representing are the enterocytes, goblet cells, some of the undifferentiating cells. Maybe it shows the mitotic signs of the mitotic division, and these cells having these red granules inside, they are the Peyer's spreadsheet, the Punnett cells. Sorry, the Punnett cells secreting lysozyme. We covered that previously. So it's an antibacterial substance against the foreign materials. And we can mention another cell type, maybe here, it seems, or there, this. So this is an enteroendocrine cell which eventually secretes its hormone into the extracellular space, causing endocrine or paracrine effects. So in the crypts of Lieberkühn, we can find enterocytes, goblet cells, Punnett cells, undifferentiating cells, and did I say enteroendocrine cells as well? So these cells are presented building up the crypts of Lieberkühn in the lamina propria. Then next layer under the propria here, this is it. This is the muscularis mucosae. This is the muscularis mucosae. Look at that.
Dr. Katz?
Yes.
Sorry, in the crypt of Lieberkühn, there are enteroendocytes, Punnett cells, goblet cells, and you said there was a type of endocrine cell somewhere else?
The enteroendocrine cells. So enteroendocrine cells, the simple columnar cells, the enterocytes, goblet cells, Punnett cells, and undifferentiating cells.
So enteroendocrine cells, but also the enterocytes, which are the epithelial covering.
Yeah.
Also.
Yeah, also.
Okay, thank you.
You're welcome. So muscularis mucosae, which is built up by two layers, inner circular, outer longitudinal smooth muscle layer. So, but it's hardly to differentiate the two layers. And underneath, we have the submucosa. So this is the submucosa here, there. So this is the muscular layer. So between them, we can find the tunica submucosa. This is loose connective tissue, or eventually moderately or relatively dense, because we cannot see huge gaps among the fibers. So we can say it's moderately dense connective tissue. So coarse collagen bundles. Onto the top of them, we can find the nuclei of fibrocytes. They eventually produce the collagen fibers here, and definitely among the fibers, red vessels, red blood cells, and adipocytes are presented. And also we can find some parts of the components of the enteric nervous system, so called submucous plexus or Meissner's plexus. This is a Meissner's plexus. Here we have a beautiful parasympathetic ganglionic cell. That is the nucleus. There is a prominent nucleolus. So this is the Meissner's plexus, which eventually innervates the vessels here, the wall of the vessels, and the muscularis mucosae. So just small components of the enteric nervous system. You remember, they are independent from the central nervous system. Okay, that was the submucosa. Let's
Dr.
see.
Katz,
Yes.
can you repeat what you said about Meissner's plexus?
Part of the enteric nervous system. There. Maybe it's better. It's here. So this is a ganglionic cell, parasympathetic ganglionic cell. Prominent nucleus is presented, and unmyelinated nerve fibers also. So the Meissner's plexus eventually innervates the wall of the walls of the vessels in the submucosa, and also innervates the muscularis mucosae.
Okay, thank you.
Okay. You're welcome. Then next layer. So this is the don't play, children. So this is the muscularis externa. This is the muscularis externa, having two layers. That is the inner circular, and that is the outer longitudinal layer. And between the two layers, we can find the mesenteric plexus, the Auerbach plexus. So this is it. These are also part of the enteric nervous system, having also ganglionic cells and unmyelinated nerve fibers. So here we look at that. That is a whole structure. This is a mesenteric plexus. It's much more bigger than the Meissner's plexus because it innervates the muscle layers of the muscularis externa. So we can find parasympathetic ganglionic cells. The prominent nucleoli are also presented, and nerve fibers as well. So Meissner's plexus innervates the vessels of the wall of the vessels of submucosa and the muscularis mucosae, while the Auerbach plexus, the mesenteric plexus, innervates the muscle layers of muscularis externa. Then outermost layer, because we know, everybody knows, the small intestine, the jejunum and the ileum is intraperitoneal organ. Eventually we can find a sharp border separating these intestines from the environment, representing mesothelial cells. So here we can see the nuclei of the mesothelial cells. So there is a sharp border. That is another one, the sharp border of the serosa covering. So the outermost layer is the serosa, tunica serosa, because it's an intraperitoneal organ. One more thing which is not presented on the this slide, but eventually it's mentioned by the booklet, and it's important. It relates to the Peyer's patches, but I wanna say, so these cells, the M cells, so M cells, we cannot identify them. Just the immunohistochemistry can reveal their position. So the M cells are kind of modified enterocytes. So they are modified enterocytes, really close to the Peyer's patches. So I mean, on the antimesenterial side, as modified enterocytes, they are presented among the surface epithelial cells. Eventually they uptake the bacterial substances and eventually represent them at the basolateral. So eventually they uptake the bacterial particles from the luminal side of the cells and show them at the bottom, at the basolateral side, toward the cells in the Peyer's patches. So they are eventually a kind of, or a modified APSP cells, antigen presenting cells, or kind of initiating cells. M means microfold, because it has a wavy bottom. So it's a modified enterocyte, and eventually shows antigens. So it's a kind of antigen presenting cell, and shows the bacterial substances to the lymphocytes close to the Peyer's patches. Okay. Then let's move on. Our next slide is the number 68. Yeah, that's the colon. So when we're talking about the colon, the large intestine, first you should mention from the surface increasing structures, what we covered related to the small intestine, only microvilli are presented in the colon. So colon represents neither Kerckring folds nor villi. We can see just similar structures, but they are eventually just mucosal folds, but not typical Kerckring folds, not long plicae circular folds. So they are just mucosal folds, no Kerckring folds, and no villi are presented. So when we are increase the magnification, that area is best. So eventually they are more or less similar to the upper surface of the lumina surface of the stomach, the gastric pits. So we can see these finger-like processes onto the surface of these folds. So this is the typical appearance of the mucosa. And there is another thing. The number of the goblet cells dramatically increased. So numerous goblet cells are present, more than in the small intestine. So goblet cells are everywhere, almost everywhere. Obviously, when we just see the layers, layer by layer, the epithelium represents simple columnar cells, enterocytes. They are enterocytes also, and the top of the enterocytes may be there. Yeah, you see this shadow like something. That's the microvilli here. So microvilli at the apical surface. That's the only one surface increasing structure in the large intestine. The epithelium mucosae is enterocytes and goblet cells. Lamina propria also loose but cellular rich lamina propria. So numerous lymphoid elements are presented. More lymphocytes are presented than in the small intestine. And also in the propria, we can find these circular glands of the intestine, also called crypts of Lieberkühn. So they are the intestinal glands, crypts of Lieberkühn, and the cells in the crypts, also goblet cells, enterocytes, undifferentiating cells, and enteroendocrine cells. But in a healthy colon, no Paneth cells. I know the booklet says different, but in healthy colon, no Paneth cells are presented. Paneth cells are typical cells of the small intestine. So when we are just looking at this aspect, we can see Paneth cells, just goblet cells, and enterocytes here. So these are the enterocytes, goblet cells, but we can see enteroendocrine as well. But here we have some. Look at that. So these are, and this also enteroendocrine cell. Okay, so no Paneth cells. Yeah, let's see the muscularis mucosae. So here, this layer, this is the muscularis mucosae right underneath the propria, inner circular, outer longitudinal, smooth muscle layers as before. So inner circular, outer longitudinal forms the muscularis mucosae. Then this area is the submucosa, which is typical loose connective tissue. This is typical loose connective tissue having numerous adipocytes, vessels, and obviously we can find Meissner plexuses, for example, here. So this is it. That is a Meissner's plexus really close to this vessel. So that is the submucous plexus innervating the vessels of the submucosa and muscularis mucosae. There is another one here. Yeah, there as well also. There's the ganglionic cell. And definitely coarse collagen bundles everywhere and the nuclei of the fibrocytes are presented. So that's the typical submucosa. Let's see the muscularis externa. This is the muscularis externa. 2 layers, inner circular, outer longitudinal layer. So that's the circular, that's the longitudinal, and between them we can find the Auerbach plexuses. This is it, and here is another one. So innervating the layers of the muscularis externa. When we just increase the magnification, we can see the parasympathetic ganglionic cells just among the nerve fibers. So this is a ganglionic cell as well. Large intestine is a little bit different, just related to the outermost covering, because the anterior and lateral sides of the ascending and descending colons covered by peritoneum, and only the posterior part is attaches to the posterior body wall, but the transverse and sigmoid colons are intraperitoneals. But when we are looking at this slide, and we can see this huge amount of adipose tissue and connective tissue fibers, so definitely that section doesn't represent the colon, I mean the transverse colon, neither the sigmoid. So here we can see eventually the typical adventitia. So it's, you know, the ascending and descending colons are retroperitoneal structures. So here, this area is free of mesothelial cells. So this is a typical adventitia. But I think if we just check this side, here we can see a sharp border, a sharp edge. That is the mesothelial covering, or it seems the mesothelial covering, but it's tiered. But just look at that. So that side is really sharp. So this is the peritoneal covering, while the other side, this side, that is just covered by irregularly arranged connective tissue elements. So that's it.
What's the difference again between them? Like, how does it look different, the adventitia from the mesothelial layer?
I just said. So
I know, but I couldn't see when you pointed at it.
Numerous adipocytes, connective tissue fibers, much more thicker, and there is a just irregular border. When we are looking at this side, so there is a much more thinner, and there is a really sharp border isolating it from the neighboring structures.
There's still connective tissue and adipocytes.
Of course, though. Of course.
So it's just the border that we're looking at.
Not just the border, the thickness. Look at that, it's so messy. We can see the exact coat.
Right, okay, thank you.
Okay, you're welcome. There is another thing, just looking at this. So maybe here we have an extra. So let's look at that side, but it's just maybe probably the thickening. You remember the morphological features of the large intestine. So one of them is the tinea. So this is a thickening of the external longitudinal layer of the muscularis externa. So here we can see one of the tinea. No one knows which one is that. So so this is one of the tinea. So look at that. it's much more thicker than the others, but we can see the others. So maybe here another, but it may be caused by the exact section. But it seems this is this part of the longitudinal, the outer longitudinal layer of muscularis externa is a tinea. Okay. There is another thing I just wanted to show. So here is the lymph follicle. So everywhere in the colon we can find lymphoid aggregation, lymphoid filtrations, so, and sometimes lymph follicles as well, because you know the number of the bacteria is much more higher in the large intestine than in the small. So there is another thing, look at that. So this is a typical lymphoid infiltration because it infiltrates the propria, muscularis mucosae, partly the mucosa. Okay, so lymphocytes are everywhere, everywhere. Now that was the colon. Let's move on. Let's see the appendix. That's the 69. There. The layers of the appendix is quite similar to the colon. Just the size is completely different because it's much more smaller. And in the lamina propria, we can find huge lymph follicles. So these are the huge lymphoid follicles here, there. We haven't covered the tonsils and the lymphatic system yet, so just you need to, these are the lymph follicles. Okay, that's it. Having obviously filled by numerous lymphocytes. Then at the top we have still enterocytes and goblet cells. Lamina propria represents crypts of Lieberkühn there, and represents cellular rich loose connective tissue. And also in the propria we have these follicles, these follicles. And under the propria there is a really thin layer here. That's the muscularis mucosae. Maybe it's a little bit better there. So that's the muscularis mucosae, inner circular, outer longitudinal layer of that. There is a lamina or tunica submucosa. In the submucosa, we can find collagen fibers, vessels, adipose tissue, and it's a kind of smooth muscle, and I thought it's a Meissner's plexus, but maybe it's there, maybe here. So this is in the submucosa, and then so it's quite similar to the submucosa of the colon. And the last layer is the muscularis externa here, there. What happened? So that is the sorry.
What is the muscularis internus?
This is the muscularis externa. The muscularis interna doesn't exist.
Okay.
That's the muscularis mucosae, but no muscularis interna.
Okay.
So this is the inner circular. That's the outer longitudinal layer. And between them we can find the Auerbach plexuses, but because of the thin wall of the, maybe here, yes. So it's a little bit difficult to find them. So there is the mesenteric plexus here, also innervating the two layers of the muscularis externa. Then,
but Dr. Katz, does the appendix exhibit peristalsis?
Yes, why not?
Oh.
But it's also part of the intestine. and it has a various length.
Cool. So this plexus, it goes all the way down to the rectum.
Yes.
Okay.
Yeah.
Thank you.
Yeah. Even the submucosal and the mesenteric plexus as well. Last layer, that's the adventitia. This is the adventitia. Serosa, sorry. So it has own peritoneal covering called mesoappendix, and when we just increase the magnification, we can beautifully see the nuclei of the mesothelial cells. So here, so there is a sharp border, and there is a thin layer underneath. That's the subserosa, having fine reticular and collagen fibers. So this is the serosa covering the appendix. That was the appendix. Okay, let's move on. Our next slide, I think the next is, the liver. We're gonna start the liver, the number 71. Yeah, that's the one. So when we're looking at this ordinary view of the liver, we can see some vessels just penetrating the exact tissue. But when we increase the magnification, we can see a capsule of the liver. So this is a dense, irregular connective tissue of the liver called Glisson's capsule. So this is the Glisson's capsule. It is just a simple, dense, irregular connective tissue coat around, and where we have the bare area, only the Glisson's capsule fuses with the diaphragm, but everywhere else there is a peritoneal covering as well. So the bare area represents only the Glisson's capsule, no peritoneal covering. Now let's focus on the tissue. So I think it's good. So look at that, just looking at this view. Here we have something in the center, and there is another one, there is another, here we have another. So some holes are presented. So here, there. These are the centers of the hepatic lobules called central veins, and approximately here we have the exact edge of one lobule. There is another. The lobules usually hexagonal shaped structures, having centrally a vein, that is the central vein, and from the vein to radiaire we can find hepatocytes in orders forming rows called hepatic courts. So eventually the hepatocytes presented in rows called hepatic courts, and among the hepatocytes, the hepatic courts, we can find hepatic sinuses. The sinuses represents obviously the blood. And at the periphery, just among the lobules, the hepatic lobules, we can find structures, sub-branches of the hepatic artery proper, portal vein, and lymphatic vessels, and also the bile canalicula, the bile vessels. So I'm gonna show them soon. So that's the hepatic lobule, centrally representing the central vein, which drains the blood entering into the lobule. So let's see the cords, the hepatic cords. So these are the hepatocytes, and among them where we can find the red blood cells, these are the hepatic sinuses. So full of red blood cells are presented, indicating the hepatic sinuses. These vessels eventually, just among the hepatocytes, are covered by fenestrated endothelial cells. So when we are looking at this area, the blood, not just the red blood cells are not just presented just really among the hepatocytes, because they covered by, so they are proper vessels having endothelial cells, a specific endothelium. This is a fenestrated endothelium because of the filtration, because of the material transport through the vascular wall. So it's necessary to present gaps, for the vessels. Then another thing I said, at the periphery we can find
Sir,
yes,
the fenestrated epithelium are the white area between the red blood cells.
that lines the white area, the sinuses.
Okay, thank you.
So here, so look at that. Now we are lucky. Because we can see the nucleus of endothelial cell. So here this is a sinus. This is a hepatic sinus. It's a vessel. Here we have a nucleus of endothelial cells. They are fenestrated endothelial vessels. Okay.
Okay, thank you.
So, Dr. Katz, could you please explain again why it's fenestrated, what the advantage is?
You know, the liver has numerous functions. Beside the detoxification, all of nutrients from the GI tract eventually collected by the hepatic vein, the hepatic portal vein, and eventually the liver is essential for the utilization of these materials. So eventually there is a really intense absorption from the sinuses. There is a space just between the hepatocytes and the lamina bassalis, the basement membrane of the endothelial cells, called space of Disse. This is the space of Disse, between the hepatocytes and the basal lamina of endothelial cells. We can't see this space here on the light microscopic, during the light microscopy. But you remember when we studied the reticular fibers and we used the silver-stained liver, the silver impregnation. So the dark fine fibers were presented just covering the hepatocytes. So these reticular fibers are in the space of Disse. But among the fibers, the reticular fibers, we have cytoplasmic processes of hepatocytes, the hepatocytes as well. They uptake the nutrients from the sinuses. You know, these sinuses eventually carry blood of the portal vein mainly. So it's a nutrient-rich blood, and the hepatocytes just uptake the nutrients because the processes of them are located in the space of Disse.
Oh, so they pierce the endothelial wall, sort of, so they can take up the blood.
No. That's the point of the fenestrated endothelial lining. So the nutrients go through, they penetrate. Did you mean that?
So the fenestrations are the spaces of Disse?
No, the space of Disse is a space.
Under the cell?
Under the basement membrane, okay. So here we have the lamina basalis of the endothelial cells. Here we have the nuclei of endothelial cells there. There is the opposite side, okay? So this is a vessel here. And there, we have gaps, pores of the vessels. That's called fenestrated endothelial cells. And here, because it's a huge cell, the hepatocyte, here we have a hepatocyte. That is the nucleus of that. And this area, this is the space of this cell, okay? And the cytoplasmic processes of the hepatocytes can uptake the nutrients from the blood sinuses. Well, that,
right. So so it's fenestrated so that these processes can reach in a way.
yeah.
No.
But the process does not the processes do not penetrate the wall of the vessels.
Mm-hmm. Okay, I think I got it. Thank
Okay.
you.
Okay. Then, so if we covered this sinus story almost completely, I want to mention another cell type here. I think it's beautiful that cell inside. This is a typical cell called Kupffer cells. So Kupffer cells. Kupffer cells are macrophages, hepatic macrophages, and they able to eliminate the old and degenerated red blood cells. So that's the reason, the presence of the Kupffer cells is the reason why the liver is able to take the function of the spleen over. So after a splenectomy, these cells, so in the hepatic sinusoids, we can find typical macrophages with irregular shaped, or some also called bean-shaped nucleus, and there is an irregular shaped cytoplasm. So these are Kupffer cells. It's easy to differentiate, easy to recognize, because the hepatocytes everywhere have huge circular nuclei. So the cells in the sinuses called Kupffer cells, they eliminate the old and degenerated red blood cells. So just when we are moving there, there is another one. Now we can see the bean-shaped nucleus. So there is, okay? So that is a macrophage called Kupffer cell. Now let's see the periphery. It's not a nice one. I want to show the three structures. So look at that. Look at that. Here we can see a huge lumen with a thin wall. That is a venous structure. There is a small but representing more muscle layers. That is an arterial branch, and here we have a short cuboidal line structure. So at the edges of the hepatic lobules, we can find a portal triad, the components of the portal triad. So that is an interlobular vein, interlobular artery, and interlobular duct. Usually we can't see only three structures because we have numerous branches of the arteries, veins, and duct systems. So we can see three types of structures. So interlobular vein, artery, and duct. They are the sub-branches of the portal vein, sub-branch of the proper hepatic artery, and eventually that's the continuation of the bile system. So, but theoretically, And when we use electron microscopy, we can reveal another vessel here, a lymph vessel. So classificationally, this area referred as portal tetrade, so not triad. It's tetrade because of the fourth component, a lymph vessel, but we can see with light microscopy. So I'm showing another one.
Dr. Katz?
Yes.
Is the interlobular duct the same as the biliary duct?
Yeah, that's the same. That's the same. So it's not so nice, but it's really good to train yourself. So here we have it's almost circular. We can see the lumen. So prominent round-shaped nuclei. So definitely it's a cuboidal lining epithelium. This is a part of the duct system. So that is the interlobular duct. Here we have a vein. There is another one. There is another one, a huge one. And here the thick wall, but we can see properly. That's the artery, the interlobular artery. And there is another thing. Just the wall is presented, we can see the lumen, but the nuclei are quite similar to the cells in the interlobular duct. So this is a longitudinal section of an interlobular duct. I'm showing another one, maybe here. I think I can see the artery, maybe here, but it's not well presented. This is the interlobular duct, that's the artery, that's the vein. Definitely, the main branches of the vessels and the lymphoid structures, the duct system also presented. So for example, when we can see this, having a columnar or stratified columnar lining epithelium, that's part of the duct system. Here it's in really small one, look at that, really nice. And here we have an artery. So we can see the thick muscular wall. That is an artery, and there is a huge vein. There is a huge vein. Okay, so but definitely they are not interlobular structures. They are bigger branches of the vessels and the bile system. Here we have another. No, that's really nice. Look at that. That's beautiful. So here we have the interlobular duct. The two branches, the two sections of the interlobular artery, then the veins, the interlobular veins. Okay, so no three types of structures we have in among the lobules, the hepatic lobules. And there is another thing, but I definitely wanna cover. So when we talk about so just. Let's go back to this. So this is the edge. This is the edge of the hepatic lobule. Here we have the portal triad. There is another one, or there is another. Doesn't matter. So when we're talking about the direction of the blood flow, so the blood, I'm using the red color indicating the oxygen-rich blood. So the tiny branch of the hepatic proper artery carries oxygen-rich blood. That goes to the center. The portal vein, so the venous structure here is the interlobular vein. Also lets the blood get into the sinus system toward the center. So the blood goes from the periphery to the center, to the central vein. And among the lobules, maybe here, or the other parts, we can find some veins called sublobular veins. Here we have. sublobular vein. So the blood drained from the central vein to the sublobular veins, and the union of sublobular veins form the hepatic veins. You remember the hepatic veins directly empty into the inferior vena cava. So at the porta hepatis, we have the hepatic artery proper and portal vein. So they carry blood for the hepatocytes. Portal vein, nutrient-rich, deoxygenated, proper hepatic artery, oxygen-rich blood. So the sub-branches of them reach the hepatic lobules, and the blood just goes through the hepatic lobule and received by the central vein, and the central veins drained by the sublobular veins, and the union of sublobular veins form the hepatic veins entering into the inferior vena cava. But the bile, when we're talking about the bile secretion, the bile that's the yellow, the bile is secreted by the hepatocytes in opposite direction. So among the hepatocytes, we have fine canaliculi carrying bile toward the interlobular ducts. And also, by the way, if we cover the theory, the lymph also follows this direction. So the lymph vessels, what we can see, I told you, also carries the lymph toward the periphery. So the blood goes from the periphery to the center, and the bile and the lymph from the center to the periphery. Now, let's see these bicanaliculi, because among the cells, we can find some fine structures. For example, here, this white line, can you see? That's the one, that's a bicanaliculi. Let's move on. There is another one here. When we can see the exact border, there is another. So these are the bicanaliculi, and they lined by eventually simple squamous cells. But the beginning of them just are presented between the hepatocytes without any kind of covering, just the wall of the cells. So the really finest structures here, there. The bicanaliculi just guarded by the hepatocytes themselves there. And then closer to the periphery, they represent first simple squamous and then simple cuboidal lining epithelium, and they become interlobular. So bicanaliculi at the lobule, then toward the periphery, they represent simple squamous and then simple cuboidal lining epithelium. At the periphery, closer to the portal triad, we can find sometimes, it's also harder to see, simple cuboidal lining epithelium. It seems, but it's not so nice. So not among the lobules, but sometimes close to the periphery, we can see another type of duct of the type of part of the duct system called Herring's canal. So Herring's canal, I'm trying to show a proper one because it's not nice. That also lined by simple cuboidal epithelium. So that seems a Herring's canal, but it's really close to the portal triad. So eventually we can't see it's a Herring's canal. Yeah, there's the duct. Here we have the vessels. There is a duct again, but here we can see the lumen, but this is a portal triad. Here we have the vein. That's the artery. It's a tangential section. Here we can see the smooth muscle inside. Here we can see the cuboidal lining epithelium. There is another one, but we can see their lumen. And look at that here. These nuclei are quite similar to the nuclei of the lining cells here in the interlobular. So this is an inter called inter. Sorry, not inter. It's called intralobular. So it's intralobular duct. It's also called canal of Herring.
Dr. Katz,
So
could you please point? Oh.
There. So this is the wall of it.
How this doesn't look different than the rest of the hepatocytes in the area.
No,
How do you tell
they are look different. Look at the nuclei of the cells. The hepatocytes usually have bigger nuclei, and they are located. So we can see a huge cytoplasm there. Look at that. They are much more bigger. There. There's a prominent cytoplasm, but we can see a huge cytoplasm. I know it's a difficult job, but they are.
They look exactly the same.
Not exactly the same. Look at that. Look at this. We can see beautifully the cytoplasm. So it's not. There is cytoplasm, but it's not so big as like this.
Okay, and specifically, where do we look for them? If you zoom out,
Close to the periphery, closer to the portal triad.
Okay, thank you.
Okay. To find the Herring's canal, eventually it's not a compulsory part of the exam because it's difficult, especially on this hematoxin eosin stain slide, because when we use trichrome, but it's not the part of the exam slides, so they are easily presented, so they are you can find them easily. So it's difficult. You see, so again, there's there's the vein. Here the duct, because of the size of the cells. There's the artery. There is another artery. Maybe here, look at that. So that's it started from there. So this is the termination of the Herring's canal. It's a little bit better than the previous one. Okay.
Yeah, it does look a bit better here.
But it's really close to the triad. So that's the point. They presented also at the periphery of the lobules. Now, I don't want to waste your time to show many Herring's canal. So you got the material. Now that was the liver. That was the liver. Our next slide. Just I wanna make sure you got this space. That's the silver impregnated. So here we have that is the round ligament of the liver. You know, it represents the umbilical vein. Here we have coarse collagen fibers, so it's a dense, irregular connective tissue fibers, and that is the vein. Here we can find the red blood cells inside. There is a limited circulation in it. Maybe it's artificial, maybe it's the exact person was alcoholic or other diseases it have, which reopened the anastomotic, the portocaval anastomosis. So there is the fatty covering of the round ligament. And here we can see on the surface of the liver the Glisson's capsule as a dense irregular connective tissue appears in black because of the coarse collagen bundles, and the reticular fibers indicate the distal space. You know, obviously we can't see the nuclei of the endothelial cells lining the hepatic sinuses. These are belonging to the red blood cells, the part of the blood. But these are in the distal space, so the fibers, the reticular fibers, just fill up the distal space, indicating it's present. Where we can find the processes of hepatocytes, where can they uptake the nutrients from the blood sinuses. Yeah. By the way, so here, it's not so nice, but we can identify. So look at that. Here we have the interlobular ducts. We can see just the exact silhouette of the nuclei of the columnar cells. So these are interlobular ducts. That's an artery because of the thicker muscular wall. And there is a vein. There is another one. There is another vein. Here we have the duct as well. That is an artery because of the thicker muscular wall. But on this slide, eventually, the importance is the space of this islet type in the or the type of the reticular type of the connective tissue fibers. And let's see the gallbladder, the number 3. Yeah, so the gallbladder, oh, where is it? Here we have. It shows 2 sections of the bladder. That's the cervical, that's the neck region, that's the bottom, the fundus. We are focusing on this. It's much more better to cover the material of the gallbladder. So inside the gallbladder, we can find numerous mucosal folds. Eventually, the gallbladder stores the bile. So it's a main mistake when somebody says the gallbladder secretes the bile. That's a failure question. Hepatocytes secrete the bile. The gallbladder just stores it and absorbs the 80% of the water level, so concentrates the bile. When we are looking at the exact layers, so let's see the lining epithelium. It's not unfamiliar for you because you studied the simple columnar epithelium on the gallbladder, the internal surface of it. So here we can see the simple columnar cells having microvilli. So these at the top are the mass of the microvilli absorbing the water from the bile. And among the cells, the simple columnar cells, we can find some goblet cells. So there, so a few goblet cells are presented among the columnar cells. Then these folds, these mucosal folds, at the center represents lamina propria. So the lamina propria is a cellular rich, loose connective tissue having numerous lymphoid elements, so it's quite similar to the intestinal wall. Here we can see a vessel. Look at that. So in the middle, we can see the red blood cells and white blood cells. Numerous white blood cells are here, and these are the nuclei of the endothelial cells. So the lining epithelium and full of neutrophils, mainly because they are segmented. There is a eosinophil, there is another eosinophil. Because of the segmented nuclei, these are mainly neutrophils. So that was the lamina propria. And
Dr. Katz?
yes?
Sorry for interrupting again. The cells you pointed at, you said they were endothelial cells?
Yes.
But that's the first time we saw a cytoplasm for endothelial cells. It's usually just the nucleus.
You can see the cytoplasm. That is the nucleus. This should be the place for the cytoplasm.
Oh, it's really big here.
Yeah, it's
okay.
big. It's
Thank
big.
you.
And to find the other layer, I should increase the magnification. So this is the wall. So look at that. Just try to observe this wall. Now you can see the complete wall. So there. So what's the next layer? What's the next layer under the lamina propria? So look at that. This is a thick one. So and there is a loose area having a sharp covering. So this is our first slide, which represents neither muscularis mucosae nor submucosa. So we have some similar slides, such as the fallopian tube, seminal vesicle, ureter. But some of the organs show different arrangement of the luminar layers, wall layers. So no muscularis mucosae, no submucosa, just lamina propria, and muscularis externa are presented here. So in the tunica, the muscularis externa, we have differently arranged muscle layers. So we have circular, longitudinal, and some of the oblique fibers are also presented. So for example, look at that. That is longitudinal. That is circular, and again also longitudinal. So some of them is oblique. So differently arranged muscle fibers, muscle layers are presented, and underneath the muscularis externa, we have the outermost layer, and you know the gallbladder is a little bit different than the other organs because it also represents two sides. There is a serosal side and there is an adventitial side. So when we are just please mute yourself. When we are look at the external surface toward the posterior side that is covered by peritoneum. The internal surface which attaches to the liver, that represents adventitia. So when we are looking at this really sharp border of the wall, so definitely we are looking at the serosa. So there is a serous covering. So that section represents the serosal part. Here we can see the nuclei of the mesothelial cells. There's other one, so here, and it's a simple squamous covering, and underneath there is a prominent subserosa, so having connective tissue fibers, but mainly fine collagen fibers and fine reticular fibers, and some adipocytes are also presented. So that is the serosal part, but you should know there is another side of the gallbladder having adventitia as well. And also it's not unusual in the gallbladder to find lymphoid follicle here in the wall. And also we have lymphoid infiltration as well. So that's the one. Maybe you can observe it there. So we have lymphoid elements everywhere. Okay. Our last slide is the pancreas. That's the number 70. Now we are just focusing on the external, the exocrine, the glandular portion of the pancreas, because the pancreas represents an endocrine and exocrine parts as well. So the exocrine parts are the glandular portion. So when we are increase the magnification, we can find some circular islands in the pancreas. These are the islets of Langerhans. So these are paler circular structures. These are the islets of Langerhans. These form the endocrine part of the pancreas. It's covered by next semester. So we should focus on the glandular, the exocrine part of the pancreas. So when we increase the magnification, we can see the acini, the mass of the acini. They are serous acini purely. So the pancreas is completely serous. The typical appearance of the serous acini are presented, darkly stained. We can see the lumen. The nuclei are round-shaped. They are presented at the middle or the basal part. So definitely different than the mucus acini. So these are the serous acini. And there is another thing which is quite typical, really typical to the pancreas. One of the cells from the intercalated duct, that leads from the acini. One of the cells, the nucleus of them, are projected into the center. So it's quite typical of the pancreas. So one of the cells projected into the center, that is eventually referred as centroacinar cells. So here, so that is an acinus, and here we have the centroacinar cell. There is it's a bit disorganized, but here we have another centroacinar cell. That is another acinus here, and there is another centroacinar cell. So I think it's easy to find centroacinar cells, and I'm just writing. Also called centroacinar cells, but it's the same thing. So centroacinar cells, but these cells are belonging to the intercalated duct, which leads from the serous acinus, and it's frequently presented when it projected into the lumen of the serous acini. So it's quite typical. When we're talking about the duct system of the pancreas, we should mention only intercalated ducts and interlobular ducts forming it, so no striated ducts. So you remember the striated ducts, they are having a wavy bottom for the large amount of mitochondria. So we don't have striated ducts. We have similar ducts, but don't call them striated ducts. For example, this is a kind of a small part of the duct system because it represents cuboidal or more or less short cuboidal duct. So it's part of the duct system, but don't call it a striated duct. Looking at this area, so here these cells are part of the cellular structures at the wall of the intercalated. I try to show a lumen of the intercalated ducts. So these are definitely, so these cells, because of the paled cytoplasm and the round-shaped nuclei, definitely they are the longitudinal section of the intercalated ducts. There is another one here, this, and that. So they are intercalated ducts conveying the pancreatic juice toward to the duct system. And it's also, there is a cuboidal one here. There is a preservated pancreatic juice. And that is a better area. So look at that, the cells inside. There is something red here. These are the zymogen granules, the typical components of serous acini, the zymogen granules, the inactive form of enzymes. You know, the pancreatic juice represents numerous enzymes, the lipase, trypsin, chymotrypsin, collagenase, elastase, amylase. So numerous enzymes are secreted by the external glandular portion of the pancreas. They are presented in the pancreatic cells in inactive forms called zymogen forms. So there is another, look at that, there is a really nice serous acinus, and at the center here we have, but also we can say for this as well, the centroacinar cells, but they are belonging to the intercalated duct, the first part of the duct system. And the pancreas represents some small lobules here, and among the lobules we can find the bigger interlobular ducts. So look at that. There is a huge duct lined by stratified columnar cuboidal cells. There is a preservated pancreatic juice again. So this is an interlobular duct. Maybe there is another one somewhere here. But it's not interlobular because it's smaller and it's lined by a simple cuboidal epithelium. It's intralobular. But this is another. There. So that is interlobular because it's located between the lobules. There is the gap, and look at that. It seems 2 layers, but it's also small. The 2 layers of covering. It's maybe the transition from the smaller ones. You see here we have that is also lined by simple. That is simple. It's also simple, and it's getting stratified here. That is also simple. So there is the union of the small intralobular ducts. Okay. Do you have any questions? So that is the exact transition, I think, because it's really small. Look at that. It's smaller than the exact acinar components. So this is an intercalated. It seems the transition between the intercalated and other intralobular So it's really small. Here we have, that's nice. That's really nice. Look at that. Finally, there is a proper cross-section of intercalated. That is an intercalated.
So the difference between an intralobular versus an inter is that the inter are thicker than the intra?
Yeah, so the ducts, so the part of the duct system in the lobules refer together intralobular, and among the lobules we have interlobular ducts. So the intercalated also one of the intralobulars, but they bear specific name. But the bigger ones in the pancreas, because it's a classificational story, we cannot mention they are that they are striated ducts. Therefore, we can just say intralobular ducts. But it's not a specific name. The other intralobulars are bigger. But definitely. So between the intercalated, so this small and this huge interlobular duct, so between them we have a transition, we have another duct system, but eventually we just call that portion intralobular duct. So the point is we don't have a typical striated duct having basal striation with mitochondria. So we have similar structures. So look at that. That seems a little bit similar to the striated duct, but eventually classificationally we cannot say for this that is the striated.
Because there's no mitochondria.
Yeah, definitely. We have mitochondria, but not in this kind of arrangement. So no basal striation.
No, they don't make folds.
Yeah.
So if I'm looking for an interlobular, I'm looking for something that's thicker, like the big one you showed us before.
Yeah.
Like this.
That is inter.
Okay.
That is inter, definitely.
And
so try to find a big lumen lined by stratified columnar or cuboidal. It is also simple. That was the big one. So this is it. So that is definitely.
Okay, thank you.
You're welcome. So, any questions? So if you don't have any more questions, we're going to continue next time. Yes?
I was just wondering if there are any updates on the exam.